Hello everyone. Today's topic is something that's really important to discuss. Medical signs you should never ignore. There are certain signs and symptoms that our bodies give us, which may indicate a more serious underlying condition. Ignoring these signs can lead to delayed diagnosis and treatment, which can be life-threatening in some cases. In this video, we'll be discussing the top 10 medical signs you should never ignore. 1. Chest pain or discomfort is one of the most common reasons people seek medical attention. Here are some common causes of chest pain or discomfort that you should never ignore. A heart attack occurs when the blood flow to a part of the heart is blocked, leading to damage to the heart muscle. Chest pain or discomfort is one of the most common symptoms of a heart attack, and it can feel like pressure, tightness, or a squeezing sensation in the chest. Angina is chest pain or discomfort that occurs when the heart muscle does not receive enough oxygen-rich blood. It can feel like pressure, tightness, or a squeezing sensation in the chest, and it can also be accompanied by shortness of breath, sweating, and nausea. Pulmonary embolism occurs when a blood clot travels to the lungs and blocks blood flow. Chest pain or discomfort is a common symptom of a pulmonary embolism, and it can feel sharp or stabbing, and worsen with deep breaths. Pericarditis is inflammation of the lining surrounding the heart. Chest pain or discomfort is a common symptom of pericarditis, and it can feel sharp or stabbing, and worsen when lying down or taking a deep breath. Gastroesophageal reflux disease, GERD, is a condition in which the stomach acid flows back up into the esophagus, causing irritation and inflammation. Chest pain or discomfort is a common symptom of GERD, and it can feel like burning or pressure in the chest. If you experience chest pain or discomfort, it's important to seek medical attention right away. While some causes of chest pain are not serious, others can be life-threatening if left untreated. A healthcare professional can help determine the underlying cause of your chest pain and provide appropriate treatment. 2. Shortness of breath. This is a sensation of breathlessness or difficulty breathing. It can be caused by a variety of medical conditions, some of which can be serious and require immediate medical attention. Asthma is a chronic lung disease that causes inflammation and narrowing of the airways, leading to difficulty breathing. Shortness of breath is a common symptom of asthma, and it can be accompanied by wheezing, coughing, and chest tightness. Chronic obstructive pulmonary disease, COPD, is a progressive lung disease that makes it difficult to breathe. Shortness of breath is a common symptom of COPD, and it can be accompanied by coughing, wheezing, and chest tightness. Pneumonia is a lung infection that can cause inflammation and fluid buildup in the lungs, leading to difficulty breathing. Shortness of breath is a common symptom of pneumonia, and it can be accompanied by coughing, fever, and chest pain. A pulmonary embolism occurs when a blood clot travels to the lungs and blocks blood flow. Shortness of breath is a common symptom of a pulmonary embolism, and it can be accompanied by chest pain, coughing up blood, and rapid heartbeat. Heart failure occurs when the heart cannot pump enough blood to meet the body's needs. Shortness of breath is a common symptom of heart failure, and it can be accompanied by fatigue, swelling in the legs, and rapid heartbeat. If you experience sudden or severe shortness of breath, chest pain, or coughing up blood, it's important to seek immediate medical attention. 3. Unexplained weight loss. This refers to a sudden and unintentional decrease in body weight that occurs without a change in diet or physical activity. It can be a sign of an underlying medical condition, some of which can be serious and require medical attention. Here are some common causes of unexplained weight loss that you should never ignore. Unexplained weight loss can be an early symptom of some types of cancer, such as pancreatic, lung, or stomach cancer. Hypothyroidism is a condition in which the thyroid gland produces too much thyroid hormone, leading to a faster metabolism and weight loss. Depression can cause loss of appetite and weight loss. Malabsorption disorders, such as celiac disease or inflammatory bowel disease, can cause weight loss due to the body's inability to absorb nutrients from food. Uncontrolled diabetes can cause weight loss due to the body's inability to use glucose properly for energy. If you experience unexplained weight loss, it's important to see a healthcare professional. 4. Abdominal pain. This is a common symptom that can be caused by a variety of medical conditions, some of which can be serious and require medical attention. Appendicitis is a condition in which the appendix becomes inflamed and infected, causing severe abdominal pain that usually starts in the lower right side of the abdomen. Gallstones are small, hard deposits that form in the gallbladder, causing pain in the upper right side of the abdomen. Gastroenteritis, also known as the stomach flu, is a viral or bacterial infection that can cause diarrhea, vomiting, and abdominal pain. Inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, can cause chronic abdominal pain, diarrhea, and other symptoms. Kidney stones are hard deposits that form in the kidneys and can cause severe pain in the back and side of the abdomen. 5. Headaches. This is a common symptom that can be caused by a variety of medical conditions, some of which can be serious and require medical attention. Here are some common causes of headaches that you should never ignore. A migraine is a type of headache that can cause severe pain, usually on one side of the head. It can be accompanied by other symptoms, such as nausea, vomiting, and sensitivity to light and sound. Tension headaches are a type of headache that is often caused by stress, muscle tension, or poor posture. It can cause mild to moderate pain on both sides of the head. A cluster headache is a type of headache that causes severe pain on one side of the head, usually around the eye. It can occur in clusters, with multiple headaches occurring over a period of weeks or months. Sinus headache is a type of headache that is caused by inflammation of the sinuses, often due to allergies or a sinus infection. It can cause pain and pressure around the eyes, nose, and forehead. In rare cases, headaches can be a sign of a brain tumor. Other symptoms may include seizures, changes in vision, and difficulty speaking or walking. 6. A persisting fever. This is a common symptom of many illnesses and is usually a sign that the body is fighting an infection. In most cases, a fever will go away on its own within a few days. However, if a fever persists for several days or is accompanied by other symptoms, it may be a sign of an underlying medical condition that requires medical attention. Here are some common causes of a persisting fever that you should never ignore. Bacterial infections such as strep throat or pneumonia can cause a persisting fever that does not go away with over-the-counter fever-reducing medications. Viral infections such as the flu or COVID-19 can cause a persisting fever that lasts for several days or even weeks. Autoimmune disorders such as lupus or rheumatoid arthritis can cause a persisting fever, along with other symptoms such as joint pain and fatigue. Certain types of cancer, such as leukemia or lymphoma, can cause a persisting fever, along with other symptoms such as fatigue and weight loss. Medications. Certain medications, such as antibiotics or anti-seizure drugs, can cause a persisting fever as a side effect. Always check with your healthcare provider if in any doubt. 7. Fatigue. This is a feeling of tiredness or lack of energy that can be caused by a variety of medical conditions. Here are some common causes of fatigue that you should never ignore. Anemia is a condition in which the body does not have enough red blood cells to carry oxygen to the body's tissues, leading to fatigue and weakness. Thyroid disorders, such as hypothyroidism or hyperthyroidism, can cause fatigue, along with other symptoms, such as weight gain or loss, and changes in mood. Chronic fatigue syndrome is a complex disorder that causes severe fatigue that lasts for 6 months or longer and is not improved by rest. Sleep apnea is a condition in which a person's breathing is interrupted during sleep, leading to poor sleep quality and fatigue during the day. Depression is a mental health disorder that can cause fatigue, along with other symptoms such as changes in appetite and mood. 8. Changes in bowel habits. Changes in bowel habits refer to any alterations in the frequency, consistency, color, or odor of bowel movements. Some common changes in bowel habits that you should never ignore include: constipation is defined as having fewer than 3 bowel movements per week. If you experience persistent constipation that lasts for several weeks, it may be a sign of an underlying medical condition, such as irritable bowel syndrome, thyroid disorders, or even colon cancer. Diarrhea is defined as having loose, watery stools more than 3 times a day. If you experience persistent diarrhea, it may be a sign of a gastrointestinal infection or inflammatory bowel disease. If you notice blood in your stool or on the toilet paper after wiping, it may be a sign of a more serious condition, such as inflammatory bowel disease, hemorrhoids, or colon cancer. Changes in the consistency of your stool such as narrow, pencil-like stools or stools that are hard and lumpy, can be a sign of a blockage in the colon. If you notice any significant changes in the color of your stool, such as black, tarry stools or stools that are pale or clay-colored, it may be a sign of a gastrointestinal problem. It's important to note that changes in bowel habits can have many different causes, some of which are not serious. However, if these persist, it is important to get the opinion of a healthcare professional. 9. The presence of blood in urine or stool. The presence of blood in urine or stool can be a sign of a serious underlying medical condition and should never be ignored. Here are some common causes of blood in urine or stool that you should be aware of. Urinary tract infection, UTI, is a common infection that can cause blood in urine, along with other symptoms such as pain or burning during urination. Kidney stones are hard deposits that form in the kidneys and can cause blood in urine, along with other symptoms such as pain in the back or side. Hemorrhoids are swollen veins in the rectum or anus that can cause bleeding during bowel movements. Inflammatory bowel disease, IBD, is a group of conditions that cause inflammation in the intestines and can cause blood in stool, along with other symptoms such as diarrhea and abdominal pain. Colon cancer is a type of cancer that can cause blood in stool, along with other symptoms such as abdominal pain and changes in bowel habits. 10. Changes in vision. Changes in vision can be a sign of an underlying medical condition and should never be ignored. Refractive errors, such as nearsightedness or farsightedness, can cause changes in vision and can be corrected with eyeglasses or contact lenses. Cataracts are a common age-related condition that causes the lens of the eye to become cloudy, leading to changes in vision. Glaucoma is a condition that damages the optic nerve and can cause changes in vision, along with other symptoms such as eye pain and headache. Macular degeneration is a condition that affects the center of the retina in the eye and can cause changes in vision, including blurry or distorted vision. Diabetes can cause changes in vision due to damage to the blood vessels in the retina. In conclusion, there are several medical signs and symptoms that you should never ignore as seen above. If you experience any of these signs or symptoms, it's important to seek medical attention to determine the underlying cause. Early detection and treatment of underlying medical conditions can improve outcomes and prevent complications. Remember, your health is your most valuable asset, and paying attention to your body's signals can help you stay healthy and catch potential health problems early. So listen to your body, take care of yourself, and don't hesitate to seek medical attention if you experience any concerning signs or symptoms. Thanks for watching.